Hey guys, Dr. Norris here. Welcome back to the Spinal Hygiene Series 2.0. Today we're going to talk about shoulder mobility. So you may have seen some other videos talking about mobility or flexibility. What's the difference? Well, mobility just usually requires a little bit of motion involved versus a stretch, or flexibility I should say, is more of like a stretch and hold, okay? You could achieve both potentially at the same time, but that's not for today's video, okay? So we're going to be focusing on getting the shoulders moving better and stronger. Here's the deal. If you live in the 21st century, I'm assuming you're watching this video in the 21st century. If you live in the 21st century, if you have a cell phone, if you work at a computer, if you commute for several hours a week, if you sit at a desk, we do a lot of sitting. And so whether or not you have shoulder pain or neck pain, this exercise is going to be good for you. A lot of people don't know that non-traumatic rotator cuff tears are the #1 cause of rotator cuff tears these days. And so a lot of people think, granted, maybe you do hurt it doing something out hiking or hunting or skiing, but there's a lot of people come into the office and have rotator cuff problems who have had low activity and no trauma, okay? And the deal is that, again, the shoulders get rounded forward, just puts the ball and socket into a compromised position. And so you need to be focusing on strengthening your back and your neck, but also mobilizing your shoulder and ultimately strengthening it. But first, we got to get it moving, right? So we're going to be doing a shoulder CAR first. So that stands for controlled axial rotation. And essentially, we're just going to move that joint through its full range of motion the best we can. Now, this is for bonus points, this little foam roller here. Not everyone has a short foam roller. You potentially could use like a yoga block. But when I put this, and you can see I'm kneeling here, but when I put this between the knee and the wall and my knee, what it's going to do is just kind of activate some of these core muscles so that as I'm moving my shoulder, I'm not going to turn my body, okay? So what I don't want to do is be facing the wall by the time I'm done this exercise. Now in the beginning, if you're really tight, there's going to be a little bit more motion happening in your spine. But what I would encourage you to do is just kind of go through it slower, feel those stretches and increase flexibility as we're mobilizing. But essentially what you're going to do is as you press the knee inwards towards the wall, I can feel my adductor activate, I can feel my core activate, and then I'm right up against the wall here, right? So my hip's almost touching, and certainly the side of my torso is touching. I have my thumb down, and I'm just gonna go from 3 o'clock all the way back to 9 o'clock. So now you can see my thumb is up, right? And so I'm gonna go back and forth, and really you could do it as many times as you want. If there's some pain or discomfort, I would go slower and I'd do less reps, like maybe about 5 reps of just getting here, and maybe you get a stretch in a certain position where you feel a lot of resistance. Well, hang out there for a second, get curious, kind of see if you can get it to stretch and release more. And then eventually, this is just great maintenance for that shoulder joint, right? So a lot of times when I'm warming up in the gym, I'll just get on a wall and I'll hammer out a few of those, all right? Same thing on the other side, you'll just be facing the other way. All right guys, so the second shoulder mobility exercise is gonna be what we call prone swimmer. So prone just means face down, and it's, as kind of it sounds, it's gonna look like you're swimming. So face down, and kind of like some of the core exercises, like the bird dogs, we really wanna feel some glute activation while this is happening. I don't want you to be trying to lift your chest up to create motion or space for your shoulders, but then you're pinching your low back, okay? So let's get that spine working at the same time. What we're gonna do is we're gonna just put your arms by your side, kind of squeeze your glutes so your pubic bone goes into the floor. You don't have to lift your legs up, that just kind of happens naturally as those muscles get stronger. But you're gonna push and you're gonna lift the chest up. You're gonna make a diamond on your low back with your hands. And then what you're gonna do is you're gonna take a big swim around here, and now my hands are facing down and I'm making a diamond over my head, and then I'm gonna come back. Now, keep that neck flat, chin's not down and chin's not up, okay? So flat, it's kind of lifting chin with the chest. Again, the diamond on the low back, and I want you to spin all the way around and then come back again. All right, so for those prone swimmers, you can do about 10 of those, even up to 20 potentially. Shouldn't have any crazy pain back there. If you're having a lot of pain and discomfort, let's talk about it. But in general, a lot of times once you kind of loosen things up, the range of motion starts increasing, the strength starts increasing, and you should have no pain. All right, so enjoy those 2 shoulder mobility exercises. Don't forget, that's gonna be really helpful for your spine, but also helpful for those ball and socket joints. And come on guys, if you haven't already, make sure you subscribe. We'll see you soon.